of the mouth on either side, and the bridge of the nose. This is the nose, the bridge of the nose. If I draw a line like this to the corner of the mouth here, and this side. So this whole thing is what? A triangle, right? You form a triangle, and that triangle is basically like, so this is the bridge of the nose, angle of the mouth on this side, right? And then again, bridge of the nose, the angle of the mouth on this side, and if you connect that, you have a triangle. So this triangle is what? The danger triangle, right? So why do we say it's a danger triangle?
Has connections with the brain. With the brain. Drains from the brain.
Right, there's a connection. There's a connection of these veins to the veins inside in the brain, the cavernous sinus. Which vein? So how does it occur? So normally this is supratrochlear, supraorbital. Normally they would drain into the angular, and the angular will go down. But sometimes, since these are valvulous veins, due to pressure differences, they could also go backwards, and they could drain into the ophthalmic veins. Okay, so there's ophthalmic veins that drains into the drains the eyeball. Okay, so this supratrochlear, supraorbital would go to the superior ophthalmic and superior ophthalmic vein, and then or inferior ophthalmic vein, and then we have the angular vein that would also drain into either inferior ophthalmic or superior ophthalmic vein. So they would go backwards into the ophthalmic veins, and ophthalmic veins would connect to the cavernous sinus. The cavernous sinus is located in the middle cranial fossa, and in between the cavernous sinus we have the pituitary gland. Well, it sits in the hypophyseal fossa, and basically above that you have the base of the brain. Okay, so. And that basically, so if you have an infection here or pimple, if you scratch it, if it bleeds, and if it's infected, so that infection would move through the angular vein, and then you have the lateral nasal. You see, there's also lateral nasal here. Through the angular vein, it would go to the ophthalmic vein. From there, it would go to the cavernous sinus. And so, therefore, when it gets to the cavernous sinus, you would have a brain abscess. You might have a brain abscess, you might have a meningitis, you might have might cause a tumor later on, and it would also might cause in the cavernous sinus other sorts of diseases, okay, inflammatory disease in the cavernous sinus, and that would basically would jump into the brain tissue itself. Okay, so that is the danger triangle. So this is the anterior part of the face. So this is drainage, venous drainage. If we look at, and then we have on the sides we have what do we have here? Okay, so we have so this is the posterior auricular, by the way, here. This is the posterior auricular. Okay. So posterior auricular would unite with which vein, and then you had the formation of the retromandibular vein. So how is retromandibular? Okay, so first of all, retromandibular vein is formed by the superficial temporal vein and maxillary. Okay, so this is the superficial temporal vein, right? Along with superficial temporal vein. Now, maxillary artery and maxillary vein is a deep structure. We can't really see it here. Okay, it's inside this. This is inside the parotid gland here. So these two unite, and they form retromandibular vein. So retromandibular vein is inside the parotid gland. This is the parotid gland here, as you can see. So one of the structures that is located inside the parotid gland is retromandibular vein, and it's formed by the union of what? Union of superficial temporal vein and maxillary vein. So they two come together, they form retromandibular vein. Okay. Now retromandibular, so this is retromandibular basically, I think. Yeah, this is retromandibular here. Retromandibular has two divisions, two branches.
Yeah, understood.
Anterior division and posterior division. Posterior division unites with
Okay. Rockala?
posterior auricular. So posterior division unites with posterior auricular, and they form external jugular. Okay, so let's look at it. So this is retromandibular here, and this is the posterior auricular. So retromandibular has two divisions. So we have, this is the posterior division, and this is the posterior division. This is the posterior division here, and this is the anterior division. So posterior division unites with the posterior auricular, and they form the external jugular. So this is the external jugular, by the way, here. So how do we know that's the external jugular? So it basically crosses. So this should be somewhere around here, because this whole thing is the external jugular. Okay. So this is posterior auricular. Posterior auricular should be somewhere around here. So this, it crosses what? Sternocleidomastoid muscle, external jugular. And external jugular opens to, or drains into subclavian vein, right? Okay. On the anterior side, the anterior division of the retromandibular unites with the facial, forms common facial, and common facial opens into internal jugular vein, right? Okay. So internal jugular vein, it's beneath and medial to the sternocleidomastoid. We can't see it. External jugular vein is superficial, and it crosses to the sternocleidomastoid muscle. And external jugular opens or drains into subclavian vein. However, the internal jugular vein does what? Internal jugular vein unites with the subclavian. Okay. Internal jugular unites with subclavian. So we're going to look at that later on. It forms the brachiocephalic. So that's how internal jugular. So the common facial here drains into the internal jugular. So they have the anterior division retromandibular. Anterior division of retromandibular unites with the common facial, and they drain into internal jugular. They drain into internal jugular. However, the posterior division retromandibular, they unite with the posterior auricular. They form the external jugular. Okay. So external jugular vein is important. Why? Because that's an important landmark on the sternocleidomastoid. It crosses, and it's located just beneath the skin. And if there's a bulging or distension, so what does that mean? What would you think if there's a distension of the external jugular vein? Okay, if there's a distension of the external jugular vein, that means that there's a traffic jam. So basically, this is coming from the right part of the heart. So there's something wrong with the heart, of the volume and the velocity of the blood pressure in the heart. So basically, if there's a jam there, if it's slow, it backs up. So if there's a traffic jam, remember the cars back up. So in the heart, it's like that too. So if there's a decreased amount of blood flow in the heart, somehow if the heart is not working properly, so the blood backs up, and you ultimately find that blood is backed up in the external jugular vein, and you will see that the external jugular vein has a distension. It grows out. You have this bulging or distension of the vein, and you can see it. You can see in the skin. Okay, and so there's something wrong with heart, or you might have a lung pathology or hypertension. Pulmonary hypertension, and there might be something wrong in the heart, on the right side of the heart, like a heart failure, because the heart is not working properly, so the blood is not,